Hey guys, want to do a video today about healthcare, and I've been promising this for a while, and I wanted to get one, at least one, out today. Okay, and I've been working on Cigna Healthcare. I'm working on like Sun Life and a few others. Okay, and I've been looking at like some of the cards that they have out there. You guys already know about Pacific Cross. That's my first choice, and for many reasons. There's a whole myriad of reasons that I choose Pacific Cross. But there are some other good healthcare plans out there, okay? And some of them are a bit expensive, and that's why, I'll get into all these different plans. But some of these plans that they have out here are, they're just not really that great of a plan, because like you dump money in, let's say you dump in 8,000 pesos per year, and then it builds up to 80,000 pesos worth of the insurance. Well, you can do that in a bank account. You know what I mean? So I'm not even going to cover those plans because I just don't think that they're worthwhile. Some of them will throw in like a little bit of, because they're making interest off you, they'll throw in like a little bit of life insurance along with the healthcare insurance. Okay, some of them will give you some extras, like very little. It's just not worth it. I'd rather see you guys keep the money in your bank account, because some of these cards, yeah, they pay the hospital immediately. You can do that with your ATM card if it has a Visa or a MasterCard on there. If you call your bank up in advance, and this is why I tell people, this thing is so touchy, this healthcare thing in the Philippines, and for so many different reasons. Because number one, okay, and this is going to be a long, elongated video, because there's so much to cover here, and I want you guys to be aware of that, because it's not like in the United States. It's not like in a lot of other countries. Things here are going to be different, okay? Because you have to pay, before you leave the hospital, you have to pay your healthcare bill before you leave. That is one of the reasons why I like Pacific Cross, because they have that, I think it's called the choice card. And with that card, you can pay, you just lay it down, and you're covered if it's inpatient care, and you can have it for outpatient care too. Now, I kind of am starting to recommend outpatient care for some people if you get decent coverage, okay, for a good price. Keyword, for a good price, okay? But if you have that 30,000, 20,000, or 10,000, I think you're pretty safe to cover yourself. Because I'm seeing one here, they want 158. This is for Philippine, just in the Philippine plan. They want 158.96 for only 5,000 worth of care. Now that's per month, okay, and that's expensive. From what I see, from what I saw, it was 158.96. But this is not through Pacific Cross. This is through a different plan. But I just to give you like a reasonable idea. That's for a 57-year-old. But anyway, I want to get into the Cigna Healthcare. But remember, when you are in a place, this insurance, if you don't have the money to pay the bill outright, some hospitals will not let you leave. Now, if you're in a ward with not a semi-private or a private, they have to let you leave. That's the law. They can't hold you hostage, okay? They can't hold you hostage. You just work it out with them, and you tell them where you live or whatever, and you tell them they can't hold you hostage. They cannot, and it's almost like a hostage situation, because I was in this situation, and I'm going to get into this, and then I'm going to get into this healthcare plan. Okay, I was sick one time. I went into the hospital here in town. It was when I first come over here. I had food poisoning, really bad too. And I went into the hospital. And what was funny was, I think they charged me like, I can't recall totally what it was. I think it was like 200 or 250 or something like that. They charged me, and I got very little care there. Very little. The care there was a kind of a crappy hospital. It wasn't as good as some of the other hospitals around here. I just chose it because I figured it'd be cheap, and they kind of gouged me, and not only did they gouge me, they wouldn't even let me go to an ATM to get my money. So I'm looking at my girlfriend. I said, well, how am I going to pay? She goes, well, I have the money. I said, no. I want to go to my bank and get my money, and they have to let me go. So the guard there says you can't leave until you pay. So I basically said, what are you going to do? Shoot me in the head? I said, that's really going to make your hospital look really good just because I want to go get some money to pay you people? I said, do you want to ride in the tricycle with me at gunpoint, you know, till I get my money? And they were kind of looking at me like I was kind of crazy. But, you know, in all seriousness, if you don't have somebody on the outside, if you come here alone and you get sick or something like that, you're screwed. You know, you really are. I mean, just to put it out there bluntly, you're screwed. Because these people have to bring you food. Otherwise, some of these places, they don't even feed you. You know, some of these hospitals will not feed you. The person from the outside is supposed to bring in your food. You know, and in some of these hospitals, I was not fed there for 2 days. They didn't bring me any food. You know, and that's pretty sad. You know, but that's the way it is here. So I want to give you guys the reality here too of the way things are. Now, other hospitals might be different. This could just be you know, in the case of this hospital, but they didn't feed me for 2 days, and my girlfriend says that in most hospitals here, somebody has to bring you food. Now, if you're in a COVID ward, every time somebody walks in to visit you, it's $20 for them to suit up, bring you your food. So at 3 meals a day, that's $60. You know, and you want to make sure that you're covered. And, you know, that's really key here. But anyway, we've already gone into this for 6 minutes, but I had to cover that because it's key to this here. Now, this is the healthcare company I looked at. It's called Cigna Healthcare. Okay, Cigna Healthcare is a very big company. Okay, and it's an expat company, and they have like four main plans here. Plus, they have the outpatient plans, which is totally separate. Okay. Now, I did 0 deductible, okay? And I did that for a reason, because they have these deductibles, and it lowers it a little bit, but it doesn't make a heck of a lot of difference. It's like, it's minimal, you know? And I want to see you guys get the best possible coverage you can get. And here we go. I mean, for the silver plan, this is one of the cheaper plans, but we're going to get into something called close care, which is just for the Philippines. These other plans are everywhere except the United States. It excludes the United States, but you can go anywhere in the world to get your coverage. The first one is $268.53 for a 57-year-old, and it's for inpatient only. All these that I'm about to mention are for inpatient only, okay? Because that's why I tell people to build up an emergency plan, because outpatient can be covered, and if you buy outpatient, you're going to get minimal coverage unless you get like the platinum thing, and then you buy their inpatient, and maybe they'll cover you, you know, in full for everything. Some plans will through some insurance companies, but we're going through Cigna right now, and this one here is the silver plan is $1 million annual benefit. Okay, it gives you cancer care, mental health is $5,000 per year, inpatient, day patient, and accommodation costs paid in full for private room, but no maternity. Okay, that's for the silver plan. That's one of their lower plans. Now you move up to the gold plan. Now keep in mind, let me say this as for something for the silver plan, is that $1 million annual benefit is a ton of money in the Philippines. It's not needed. So that's why I want to kind of go through this. The next one is the gold plan. $2 million annual benefit, inpatient, day patient, accommodations paid in full, private room, mental health $10,000, maternity is $7,000. It's $344.73. Okay. Then we're gonna go to the platinum, which is the king of the plans for people that have money. And keep it, like, I'm gonna repeat this again. This is all inpatient plans, all inpatient, no outpatient. Okay, because like I said, we would cover that with the emergency. You can get it if you have enough money. Now, the platinum plan here, unlimited benefit. In other words, you could go to $10 million if you had to, if you had something really serious. Inpatient, day patient, accommodation costs paid in full, private room, cancer paid in full, mental paid in full, maternity up to $14,000 if you're a woman. Okay, so those are the 3 big plans here. Now, here's another one of the problems. Let's say you're going to a really good hospital up in Manila. You're going to have to talk to these people before you go in there, or you may even want to do this if you're visiting here or something like that. is go into one of these hospitals and talk to them and say, hey, listen, I'm thinking about getting this insurance company, Cigna Healthcare. If I come into this hospital, before I can leave the hospital, if I have a private room, do I have to have that paid in full, or will you talk with my insurance company and have them pay you? Because that's a key thing here. You want to make sure that you're not going to be held, and that's, even though it's technically kind of illegal for them to hold you, they do it, and they have their guards watch you, and they won't check you out or anything until your bills are all paid. And they'll have like your girlfriend or your wife, they'll tell them, we need to be paid before we'll check him out. So you're stuck on a ward and you can't just walk out because they have guards, But anyway, we're gonna get into the what's called close care. Close care meaning close as in area, okay? And it's called close care. I guess they call it close care Philippines. I put down Philippines. Now, that's for the country you live in, okay? This is a $500,000 limit. This is really, really good, okay? And I like this one, and I like it. But again, we're gonna get to that thing about payment, okay? So let me finish this first. $500,000 limit, $250,000 condition limit. That's pretty good in the Philippines. That's excellent, excellent coverage. Semi-private room, I can live with that. It's not on a ward. It's still, you're in there with somebody else. You have somebody to talk to, like I said, semi-private room, full cancer care, no maternity, and no medevac, okay? That's $201.80 in US dollars, okay? Now, for outpatient, this is the one I was talking about. The price that I got online, and they said is $158.96 per month, okay? For outpatient. Now, that's for $5,000 worth of care each year, okay? I find that a bit expensive because you're paying, what if you don't use it? You just wasted all that money. You threw it away. This is why I tell you again, have emergency money, and then have enough money to be able to replace that emergency money too. And you guys coming over here on limited budgets, we're going to cover that too, because you can get good health care over here on a limited budget. This one here is for somebody that's probably, maybe you're making $1,500 a year, or $1,500 a month rather, $1,500 a month, or $2,000 a month, or $2,500, or $3,000. This close care Philippines from Cigna is actually a pretty decent plan for $201.80 a month. You're getting $500,000 worth the coverage, and $250,000 condition limit. It's excellent. Sorry about that, guys. Anyway, I also want to do like I said, outpatient is available. Sorry. EVAC is available, vision and dental, health and well-being, okay? Close care benefits, you can get outpatient and wellness and dental care. The problem, again, we run into is the no card to pay, okay? That's the biggest reason, the biggest problem that I have here is finding one that will pay, and I'm going to do some other insurances that I'm waiting for them to call me back. This is one of the biggest ones, because it's worldwide. Cigna Healthcare is worldwide. It does exclude the United States. I believe it says exclude USA. So it covers you anywhere in the world except for the USA, okay? Which is huge, and I think because the hospital care in the United States is so expensive. But anyway, guys, I hope that helps, because, I'll go into the cost again. Silver, which is one of the lower plans with the exception of the closed care Philippines, is $268.53 for a 57-year-old. Gold, $344.73. Platinum, which is unlimited benefit, $453.60. Now, you have to keep in mind here that outpatient can get expensive if you have cancer. I'm not sure what they mean by cancer paid in full. Okay, I've tried to get them to call me. They haven't called me back to answer that question. Okay, and I think it's paid in full if you're in the hospital. Okay, maybe it means outpatient too, but I seriously doubt it because you didn't buy outpatient. So it's probably just for in the hospital only. So when you have cancer, they're gonna be sending you to all these different doctors and stuff like that. You have to make sure you have that emergency fund, or you buy their coverage. Okay. Now, and in the coming days, I'm going to be covering a little bit about some of the other companies around here, and I'll talk a little bit today, a little bit about Phil Health also. Phil Health will cover some of your costs. Okay, and some people, you can kind of dovetail these plans together. You can do more than one insurance. Okay, and that's what some people do over here. They buy Phil Health and then they buy their other insurance, and it dovetails and it covers a lot of the costs. Okay, but keep in mind, Phil Health will not cover a lot of things for expats that it will for Filipinos. Okay, and that's really, really key here. Okay, because it can be very cheap to dovetail some of these insurances together. Like you could dovetail Pacific Cross with Phil Health, and you get yourself a little bit more coverage that way, because Phil Health is very limited in their peso plans, you know, but it's good insurance. Okay, but anyway, guys, I just want to go over that. I've already did the Pacific Cross thing. Cigna is definitely another alternative. If anybody can get in touch with them, you may want to talk to them about, you know, how it's going to get handled so that you can leave the hospital. Explain to them. I couldn't get that information. I just couldn't get it. I've written to them asking them. Nobody has answered me. So and you may want to talk to the hospital when you come here. It's something you may want to have, you know, when your feet on the ground, walk into a hospital up in Manila, a really good hospital, and see what they say about that, because that's something really key. It's something that's very hard to get an answer, even from some of the hospitals, because I've asked them and they look at me cross-eyed like they don't even know themselves. You know, it's just the way some things are in the Philippines, unfortunately. But anyway, guys, I hope that helps. I hope that answers a lot of questions. You know, I mean, it's the way it is. Pacific Cross, I'm telling you, it's definitely one of the best out there. You know, Cigna's good. It's great if you have enough money to cover yourself, you know, for those outpatient costs or any costs that are not covered. Maybe some tests aren't covered or something like that. So just keep that in mind, guys. You know, Pacific Cross, that choice card is gold. It's gold here. Gold. It's gold. Because when you hand that card to the hospital and you have inpatient and outpatient on that card, they pay. And then anything that's not covered, you just pay the difference, which would be minimal if you have, you know, Pacific Cross inpatient, outpatient. Okay, they covered part of my costs when I was in the hospital for the emergency room. I didn't have the outpatient, and they didn't admit me, which I technically think they did admit me, because they threw me on a COVID ward. And then in that ward, what happened was that, you know, I think I was technically admitted, but they said no, because they let me out after they did the chest x-ray. So it's, you know, but anyway, guys, God bless, take care. I hope that helps you. And guys, don't send me anything in the comment section asking me for prices. You can go on Cigna Healthcare online and get all the answers. They'll send you a quote. Okay, guys? Thanks, guys, and God bless.